Arogya Bharati, Andhra Pradesh presents Amruthahastham, procedure for doing hands-only CPR by Rajyalakshmi R. Rao.
So let us understand the procedure for conducting CPR. First of all, you will have to check for scene safety. That is, there is no danger for the victim as well as for the person conducting the CPR. And then you will have to check for response. So both tactile as well as verbal response. And it will be in this manner. Krishna, 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 Krishna. So verbal response, that is, you will call out his name in case you know his name, and the tactile response is you will tap the shoulders and not any other part of the body. And if there is no response, then you will call the emergency helpline, that is 108 in India and 911 in case of United States of America, and give them the correct address. Correct address is very important. So once this is done, then the next step is to check the carotid pulse as well as breathing simultaneously for around 5 to 10 seconds. And to check the carotid pulse, you will place your fingers and move it towards the windpipe around 2 centimeters, drawing it to yourself. And then simultaneously you will check the chest movements, that is the breathing, and start counting in this manner: 1001, 1002, 1003, 1004, 1005, 1006. And you are counting it from 1001 because the length of the word, that is 1001, will account for 1 second. So you will do so rather than counting 1, 2, 3, 4, 5, which is very fast. And once you see that there is no response, no breathing as well as no pulse, then you will start the hands-only CPR. So for doing the hands-only CPR, first you will have to see that the victim is placed on a firm flat surface, and then his head should be in an upward position. Rather, the face should be in an upward position, not the head. And then what you shall do is you will be kneeling down just like how I am beside the victim, and you will expose his chest in this manner, and then you will start the CPR. That is, you will place 2 fingers near the lower edge of the sternum or his breastbone, and take the heel of your palm and place it on the middle of the chest, that is on the lower half of the sternum, and lock your fingers in this manner. Interlock the fingers in this manner and lock the elbows so that they do not bend while doing compressions. And then you will start the compressions, chest compressions, but while doing so, you will have to see that your palm as well as your elbow and the shoulders are in a vertical position on the breastbone or the sternum in a straight line. And then you will start the chest compressions, which will be 100 to 120 chest compressions per minute, and the depth will be 5 to 6 centimeters. So you will start the compressions, and while doing so, you will count loudly: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You will take a break of 2 seconds, and then once again you will start the compressions, that is 30 compressions, and you will do so continuously till the emergency help arrives.